untreated heartburn or acid reflux can lead to cancer, which is pretty crazy. If you want a way to force your body to permanently stop acid reflux and heartburn in 48 hours, click the link in the description below. For now, let's get to today's question.
The question, is it safe to take heartburn medicine every day for extended periods of time? Everyday health. Although heartburn medications are very popular and widely prescribed, the safety of some types has been called into question. Are heartburn medications safe for long-term use? Are some more effective and safer than others, or does it depend on the patient? Worth watching. Heartburn no more, TM. I believe that for most patients the long-term benefits of heartburn medications outweigh the risks. That being said, as gastroenterologists we see the patients who suffer the most with heartburn and those whose heartburn causes significant other conditions. There are many different classes of medications for heartburn and even more brands in each class. For other than patient-driven over-the-counter use, a primary care provider or gastroenterologist can help counsel and direct a patient as to the proper medicine for their specific needs. As with any medications, the longer you are on it, the higher your likelihood of developing a side effect from it. There are some patients with chronic heartburn, Barrett's esophagus, which is a precancerous condition, or patients with a history of ulcers who are on blood thinners who require long-term heartburn medications. In other patients, I use the shortest duration possible. I always instruct patients to supplement with calcium and vitamin D while on these medications. They are all generally safe, but the class of proton pump inhibitors are usually more effective than the older histamine 2 blockers. The problem with heartburn medications is that they don't fix anything. However, they can give you temporary relief. That is where the problem lies. We are lulled to sleep, thinking that everything is okay because we don't feel any pain. The truth is that the acid is still traveling up and down the esophagus doing damage, essentially eating the flesh. This is how people end up with conditions like Barrett's syndrome, which is Crohn's disease, only 14 inches higher, which is almost irreversible. So while the medication itself is not toxic, the end result is, as it is helping you to not feel pain, it is preventing you from being aware of the ongoing damage being done. The best scenario is to use these medications while you are doing something that will actually fix the problem. Heartburn, acid reflux, Barrett's syndrome are all 100% curable. There are 3 types of heartburn medication: antacids such as Maalox, Mylanta, and Tums, H2, histamine receptor antagonists such as ranitidine, Zantac, famotidine, Pepcid, and cimetidine, Tagamet, and proton pump inhibitors, PPIs, such as omeprazole, Prilosec, pantoprazole, Protonix, lansoprazole, Prevacid, ribeprazole, Acifex. The antacids provide short-term relief and are safe long-term if not taken in excess. The H2 receptor antagonists block much but not all of the acid and have been considered safe long-term. The PPIs were initially released for only 3 months of treatment for the fear of potential cancer. No increase in cancer has been seen. However, other problems due to long-term PPI therapy have occurred: low vitamin B12 levels, low magnesium levels, and increased risk for Clostridia difficile, C. diff, infection, and an increased susceptibility to some causes of food poisoning. Furthermore, with high-dose, long-term use, there has been an increased risk of osteopenia and osteoporosis. A recent study reported in abstract form suggested that the people on PPIs at most risk for osteoporosis were smokers and those with low vitamin D levels. Further information is needed to clarify this issue.